brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living Tuesday, everybody. Dr. Jitka Lom is here, and we are talking about tattoos and piercings. And Dr. Lom, we have some great viewer questions. There's kind of an interesting point to this because I used to have a earring in college, one of the craziest things that we all do in college and everything. But our first question is actually about ear piercing. So you ready to rock?
I'm ready.
All right, here we go. Dr. Lom, how can I tell if my ear piercing, this person asks, is infected or if it's just healing normally? How do you discern between the two?
It can be challenging because as the hole is healing, it can be quite itchy. It can discharge a little bit, just some sort of clear liquid, and it can be quite red. If it's painful, that's your first clue that it's getting infected, or if there's like yellow pus coming out. Sometimes people also have an allergy to nickel. Most of the time when they put studs in, they're gold plated so that most people won't react. But occasionally that will wear off, or it's some other kind of stud, and you may have an allergy to nickel and start to get very red and irritated and itchy. So to answer your question, things should just be getting better day by day, less itchy, less irritated, less red. And if it's going the other direction, then maybe you need to get seen and get some antibiotics. Then the question is, should you remove your ear stud while you're eating the antibiotics? Typically, we want to try to keep the ear stud in there while you're taking the antibiotics and keeping it very clean so that the hole doesn't close, so you don't have to redo it. But if it just won't heal, eventually that stud just has to come out.
When I got an earring, like I said, in '95, they just said you have to turn it at least 2 or 3 times an hour, and then you also want to use like rubbing alcohol or something like that. Just, because
we stay away from the rubbing alcohol. We just want to use soap and water and clean hands to turn it, because if you, of course, aren't clean, then you're going to get it infected.
Where were you in 1995? I could have used your advice. Maybe you were still in med school at that time.
Yeah.
Okay, so question number 2 says, Dr. Lom, I got a tattoo, this person says, and it is starting to scab, and it's itchy. Will I cause any damage if I peel the scab? I'm not a doctor, but I could pretty much answer this. You never want to peel a scab, I would think.
You generally don't want to peel a scab because a scab is a natural Band-Aid. It's your own body's way of covering the wound until the fresh skin underneath has healed. So don't peel the scab. Just moisturize it. You can use plain petroleum jelly or Vaseline. Just put that on there. Sometimes they'll give you a topical antibiotic to just cover it again and keep it from getting infected. One thing you really should do is not expose it to dirty water. For example, go to the beach or do any other dirty activities like paintball or some other activity like that.
But how about for people that get tattoos in places, like maybe on the inside of their ankle, or on the way inside of their thigh, or in their derriere, where you obviously can't expose that when you go to work.
Right.
Like, how do you actually treat that?
Well,
right after you get a tattoo.
Right after, loose clothing. Again, a little bit of Vaseline, sometimes a dressing because it'll ooze a little bit. A little bit of gauze. And just a little bit of time, and they can take a little while before they heal, as you know.
Suffer for your art. That is the key part. Like, if you really wanted to get it, you'll put up with a little bit of itching.
And you really do have to be 18,
Oh, okay, good point. Okay, we kind of touched on question number 3, but to reiterate, what should I use, Dr. Lom, to clean my piercing? Let's talk about specific either ointments, or you've already said, not isopropyl, as I learned.
not alcohol. You can use just plain soap and water. Any kind of soap. Dove works fine, or Dial, something like that. Stay away from the highly fragranced soaps such as Zest or Iris Spring. Just Dove or Dial soap. Wash it carefully.
Won't that burn?
It usually won't. Just warm water. It's very important to use warm water and soap, and just flush it with a lot of water. And if you're not sure, you're going to the gym and there's a lot of bacteria around, you could use something called HibiCleanse, which is sort of like a bactericidal pink liquid. You can buy it at any pharmacy over the counter.
Could you even take like those pump antibacterial?
The hand sanitizer may be very irritating to your freshly pierced ear.
Oh, okay, it'll burn.
It'll burn.
Okay.
Yeah.
Well, nobody likes to be burned,
no.
That's for sure. Okay, question number 4. What kind of jewelry should be used for body piercings? You mentioned studs before, as maybe that's your starter kit, for lack of a better term.
Yeah, so stainless steel or gold, those are the 2 safe ones. That you can actually have an allergy to gold. It's not very common, but it can happen. Stainless steel, almost nobody has an allergy to. You really definitely want to stay away from nickel. anything that has nickel in it.
The reason being is?
Because nickel allergy is incredibly common. Something like 10% of the population has a nickel allergy, and you'll know that because when you wear costume jewelry, like you pick up a cheap pair of earrings someplace and you put it on, your earlobes will start to itch, or your necklace, start to itch.
So if you're thinking about getting a piercing for the first time, take a look at the color. Maybe if you're getting like a nice diamond or emerald or anything, you want to pick the stone, but you also want to pick the metal, the raw metal, or the precious metal, I should say. Okay. And our last question from our community says, why are people, Dr. Lom, not allowed to donate blood if they got a tattoo within the last half year? That's a good one. That's
a really good one. Well, because, while you are getting the tattoo, of course, you're getting lots and lots of little piercings into your skin, and there's the potential for body fluid contact. There's potential for you to have an open wound where you're contacting somebody else and picking up HIV, hepatitis B or C, or some other bloodborne infection. So sometimes there's a window of time. For example, if you went to a bad parlor and they had reused their needles and you caught hepatitis or HIV that day, it won't show up in your blood for about another 3 to 6 months. So when they take your blood for donation, they check you right away to make sure that you don't have hepatitis or HIV. And that's why that window is there, a very safe window. It's usually about a 3-month window for you to be testing positive for those bad diseases. But if they give you 6 months after a tattoo and you're still okay, then they know that your blood is safe and okay to use. Okay, and final question, could I still get my ear pierced? It's been, it's been over 15 years since the last time I wore it. I don't know, is it your style anymore? I don't know. I don't even know if my boss would let me do it at this point, so well, it doesn't hurt to ask, I guess. Okay, so I guess to wrap up, the lesson being, your body obviously is a temple, and you would agree that as a physician, but your body can also be a canvas. You can make it very beautiful and you can express yourself artistically, but be smart about it. Be smart about it.